Hi, I am Dr. Rashmi Kapoor, working as a pediatric intensivist and pulmonologist at Regency Hospital, Kanpur. I am going to tell something about noisy breathing. Noisy breathing in an infant can be because of blocked nose, and all you have to do at that time is put some saline nasal drops and clear the airway. Noisy breathing up to 1 year can be because of laryngomalacia. So at that time the child can produce a stridor, an inspiratory stridor like Laryngomalacia is the commonest cause of inspiratory stridor up to 1 year of age. It becomes all right on its own and generally doesn't need any treatment. It worsens because of upper respiratory tract infection, cough and cold, and it worsens when the child is lying on the back. So best way to nurse is to put the child on the side and take care of upper respiratory tract infection. The commonest other cause or infectious cause of stridor is croup. The child is sleeping and in sleep suddenly he gets up and starts producing sound like there may be preceding fever or may not be a fever, but this is a viral croup and it does not need any antibiotic. It becomes all right on its own, but suppose it's not becoming better and in fact it is worsening, then you must see the doctor immediately, because this is the swelling of the larynx and trachea, and it may be very, very dangerous also. So but the treatment is very easy. You go to the doctor and the doctor will take care of it. There are several other reasons for stridor in a child less than 1 year of age. They are all congenital problems, like there can be laryngeal cyst, there can be subglottic stenosis, there can be subglottic hemangioma, there can be other infections like papillomatosis, there can be vocal cord paralysis, there can be tracheal stenosis. There are several causes of stridor in a child because of the distorted anatomy. Now to confirm whether it is laryngomalacia or other causes, all you need to do is a endoscopic examination of the airway. An endoscopic examination of airway is done by flexible bronchoscopy. It is a very, very safe procedure. It can be done in a newborn also. Now the child can also produce a sound like. Now this is the obstruction of the upper airway because of enlarged tonsils or enlarged adenoids. Now tonsils and adenoids can be examined, tonsils can be examined clinically, and if your doctor sees that there is pus and it is inflamed and the child might need antibiotics, and the snoring and this sound will go away. And most of the time it is because of the enlarged adenoids in children less than 2 years of age. There may be allergic rhinitis and the child may produce something like this. So all your child needs is just some anti-allergic, and this will be taken care of. So whenever a child is producing some sound or it's a noisy breathing, one must consult a doctor. Most of the time no treatment is required. Now sometimes the children may produce a sound like so this sound is because of the obstruction of the airway lower down inside the chest, and this is because of the wheeze. Wheeze, viral associated wheeze, is a very, very common thing that your child can have, and almost 70 to 80% of children up to 1 year of age can experience viral associated wheeze. This wheeze is also present in asthma, which the child can have as asthma, and asthma is allergic. He can be allergic due to several things. So this is a very, very common symptom of viral associated wheeze or asthma, and if it is diagnosed, if your doctor diagnoses it, then do take the treatment prescribed by the doctor for your viral associated wheeze or asthma. Now children sometimes can also produce a crackly, which is known as the rattling sound, and when you put a stethoscope you find crackles there. This is the sign of pneumonia, and this child definitely needs an antibiotic. So most of the causes that we have discussed till now did not need an antibiotic, except for a few, like pneumonia, like tonsillitis, and like maybe it is an acute bacterial laryngotracheobronchitis. Rest, most of the time it is either because of the viral infection or because of allergies. So most of the time we do not need any antibiotics.